It's taken more than a day, but the scale of the disaster brought to the French overseas territory by Cyclone Chido starting to emerge now. We are getting horrifying reports from the island. Senior officials saying they fear hundreds are dead, and over the next few days, as they try to reach devastated areas, they say that figure could rise to several thousand. Roads, you can see they've been cut off. Shanty towns totally flattened on the island. The main airport, we understand, is closed, and supplies of electricity and fresh water have also been cut. All the result of 140 miles per hour winds. The cyclone hitting the territory over the weekend. And to make matters much worse, we understand the Central Hospital. There is only one big hospital there, and it suffered what is described as significant damage. Only small parts of it are operational at the moment, and that makes it harder to care for anyone who has been injured. They are still struggling as well to reach those who have been injured, and the scale of this is only really starting to emerge at the moment. Well, Mayotte is a French overseas territory. It's an island in the Indian Ocean, which has a population of around 300,000 people. It lies, as you can see here, just north of the Mozambique Channel off the coast of Southeast Africa, between Madagascar and Mozambique. The French Interior Minister has arrived on the island, briefed the staff as well on the relief efforts to be sent to Mayotte. It was a pretty moving briefing that he gave. Have a listen.
We have mountains to move ahead of us. This task, I know it will be daunting. It will be very emotional for many of you here. So please, do not panic. Stay professional, focused, and communicate with one another. The key here in our relief operation is to coordinate in the best way possible to make sure we are the most efficient to help those who need it the most.
So a calming message there from Bruno Routier, just speaking to those that were about to be involved in trying to look for survivors and also begin the cleanup and help people there. Let's give you some broader context about Mayotte. It is one of the poorest parts of French territory. Around 3/4 of the island's population live below the French poverty line. The unemployment rate is about 1 in 3, and at least a third of the territory's 320,000 people live in shanty towns. John Ballot is a 39-year-old musician and composer. He's from Comoros in East Africa. He is seeking asylum right now in Mayotte, as are many other people who live there at the moment. Let's have a listen to his experience of the cyclone.
It was the wind blowing, and I was panicked. I screamed, "We need help, we need help." I was screaming because I could see the end coming for me.
So terrifying to hear from people who are there. We have to tell you, it's really difficult to get through to Mayotte at the moment. A lot of the lines are down, as you can imagine. Telecommunications has really been affected. So we're just getting little bits of information here and there that describe how bad things are. But let's speak now to Jean-François Coty, who is president of Médecins du Monde, who has visited Mayotte before and is in close contact with people there. Good to have you with us here on BBC News. Jean-François, just tell us what you are hearing from Mayotte at the moment.
Yes, it's a huge catastrophe. You know, we have team on the field since long time, but our coordinator don't have the capacity to reach all the member of our team. So we're still very confused about what's going on for our friend on the field. It's a huge emergency because, as you said, majority of the slums has been destroyed because of the violence of the cyclone. We are in a context where the access to the clean water is a chronic issue, and now it's increased because of the catastrophic cyclone. It's a context where access to food will be difficult because this island need exportation and importation, and also because the health system probably has totally been destroyed, except the hospital in Mamoudzou, which is the capital, where people can reach some medical facility. But it's a very poor place. Majority of people, they are without legal paper. They are afraid to move because of the risk of expulsion. So it's a humanitarian context, which is very, very tense.
Jean-François, we're getting different figures of those who may have died, from a few hundred to some fear it may even be a few thousand. That is a massive number. What we do know for sure is many people will have been displaced. What is your main concern for them? Is it very basic things like there is no access to clean water?
Yeah. The fact is that we have to respond today, and we will send a few teams, Médecins du Monde on the field. We have to respond to the emergency situation through providing clean water and also food, and also respond to the emergency medical issue like wounded people, but also to provide a treatment for chronic disease for patients like diabetes or cancer. The main also issue is the risk of epidemic problem. In most of the natural disaster, there are not every time some epidemic issue, but there in this place there is cholera, which is a disease with epidemic episode not so long ago, and many times this Mayotte Island has to face cholera epidemic issue. So because of this catastrophic event, the access to clean water is more difficult, as I said, and so there is a real risk of a cholera epidemic issue because of the deaf people, because of the difficulty to have access to clean water to drink, but also for sanitation and to clean yourself. So we are very also concerned about the food access, the water access, the way we will deal with the poor patients who are afraid to move because of the expulsion, but also we are really afraid about real risk of epidemic cholera issue. So, all the needs are important today.
Just to ask you as well, so cholera was already there, obviously concerns now that could be exacerbated because of what's happening as a result of the cyclone. But what about that main hospital? Do you know if any of the hospital is still operational and functioning?
Yeah, the Mamoudzou hospital is still functioning, even if it has been really part of it has been destroyed by the cyclone, but it's still functioning. It's a place where there are a lot of maternity issue and a lot of delivery. But all around, we talk about something like 20 or 30 health posts, and probably majority of them has been destroyed at the island level, but we don't have already all the information. So, as I told you before, we are also concerned about how we will deal with the chronic disease for all the poor patients which are far from the hospital, which is based in the center of Mamoudzou, and it's a real concern regarding the risk of containing epidemic, which is a real risk for the island.
Jean-François, thank you so much for joining us, and good luck to you and your teams in the coming days. It's obviously going to be a real challenge. With me in the studio is our news correspondent Marina Darras from BBC Africa. Marina, there's a lot that people don't know about what happens in Mayotte, and one of them is that there's 300,000 people who live there, many refugees and immigrants who make their way there. This is something you've done quite a lot of work on for the BBC. Tell us about the people who have made their way to the island and how they got there and what conditions they've faced.
Yes, so there's about 48 to 50% of people on the island who were not born there. So they came during the lifetime on the island. It's about boat crossings for most of them. So they came mainly from the Comoros, the neighboring archipelagos near Mayotte. They come from Madagascar, but they also come from the DRC, so much further afield, the Great Lakes region, and sometimes even Somalia, which is really far away.
I mean, when you look at this map, that's an extraordinary distance that they're travelling. Why are they coming to Mayotte?
A lot of them have been promised Europe, which is a false promise, because the laws have been changing, the immigration laws have been changing over time to prevent more people from coming to that small island. But that's what's happening. They are being promised an entry to Europe. Now, I've spoken to a lot of them who didn't even know where Mayotte was, who didn't even know that Mayotte existed or it was French, and they were trafficked just under the promises of reaching Europe, and they ended up in Mayotte.
And amongst those who are arriving, a lot of women who are pregnant too, hoping perhaps that their babies might get French passports?
Yes, because it was the case before that you would have birthright citizenship on if you were delivering your baby on the island. This has changed now. The laws have become harder and harder. They've changed over time, and we're supposed to get even more difficult this year, but the fall of the government has delayed a little bit. It is back on the agenda, I believe, because one of the MP wants to change that law, but people still think that they can deliver their babies on the island and get a French passport and maybe travel to mainland Europe, which isn't the case at all.
So, Marina, they have this dangerous journey from a long way away, often on very small boats. Then they arrive in Mayotte, and what conditions do they face once they're on the island?
So they do have access to certain part of the welfare system. So the children can go to school. They can get some sort of healthcare through the main hospital in Mamoudzou, which we've heard has been badly damaged. But they really are at risk of being detained and deported while they are sorting out their paperwork or while they are asking for asylum.
Okay. Marina, thank you very much. Really interesting. There's more on the BBC News website as well on this story. We have a live page up and running.